So I'm an orofacial myofunctional therapist, which means that my job is to retrain the muscles of the tongue and the face and the lips so that they sit in a more ideal resting posture for not just speech, but also for chewing, for swallowing, for sleeping, and for nasal breathing. So I am like a physical therapist for the tongue. And in the way SONU positively impacts my work is that congestion makes it hard to breathe through your nose, right? And if you can't breathe through your nose, you have to breathe through your mouth to stay alive. There's no other options, right? So the mouth will open, which means the tongue will fall away from the palate, and you are walking around with a very heavy organ that is putting a lot of strain on bones and facial structures that are not made biologically to hold that much weight. What's happening also, as my dental colleagues will tell you, is that if there's no retainer, if there's no natural retainer holding up the palate, it's going to start collapsing. The top of the palate is the floor of the nose. So that's going to start impacting nasal breathing and the narrowing of all of those nasal passages, as well as causing septal deviation. So the tongue is a primary for, people think speech and eating, it's things, but if you think about it, the tongue as an organ is primarily a breathing and sleeping organ, because the tongue needs to sit along the palate for you to ideally reach deep stages of sleep and natural nasal airway breathing. We're not meant to breathe through our mouth.